So now we need to define what is mobility. And there are a lot of different definitions out there, and ours falls into the category of one of them. We're going to define it as active range of motion, right? How far can you or your athletes move their joint through a range of motion, and is it adequate or inadequate? Now, when you start to look at mobility, there's a couple different factors at play here. It's not just the passive extensibility of the muscles, ligaments, and tendons. Now you need to have some form of motor control, you need to be able to create some torque, and you need to have strength at varying angles throughout your joint. So a good way to think about this is somebody with a less than adequate squat when you're looking at them, right? You as a coach, you're looking at an athlete and you say, I don't like something about that squat. Now, you don't know if it's a flexibility issue, which is just passive range of motion, or if it's more of a mobility issue, which is we're going to require some positional strength and body awareness. Both of those can be at play. So if we have an athlete who has a funny looking squat, we take them through the flexibility assessment and they pass everything with flying colors. That athlete does not need a flexibility intervention, and we see this all the time. People with full flexibility getting flexibility interventions, and then they're wondering why their squat isn't getting any better. And it's not getting any better because the intervention is not addressing the dysfunction, right? And this becomes a powerful tool now that you have this flexibility assessment, because now you're going to be able to look at somebody with a squat that doesn't look so good to you and say, how do I intervene here? Do you need flexibility modalities, or do you need squat therapy? And in that case, that athlete needs squat therapy. Now, on the other hand, if you have an athlete where they're squatting a little funny to you, and you put them through the flexibility exam, and you find some things. Okay, that is also a good situation, because now you understand that they are limited in flexibility, and you also understand what range of motion they're missing and at which joint. Another common mistake that we see is coaches saying, oh, it's your hips, it's your hips, it's your hips. And by the time they get to our office with a hip impingement, it's actually their ankle. Now you're going to have the tools to assess and address what's going on, what the dysfunction is in your athlete a lot more specifically, right? In the office, in the clinic, we say the treatment needs to fit the diagnosis. That's when treatment is successful. In the gym, the intervention needs to address the dysfunction, and that's when your athletes are going to be successful. But if you don't ask the body or the athlete what's going on, your interventions are not going to address their need, and that athlete will continue to suffer their dysfunction. So when you're moving through these modules, I want you to keep in mind that mobility is your active range of motion, and that there are other things at play. We always want to defer and look at flexibility when we see a mobility issue, because then that will tell us what we need to do after the fact.